to XConnect. My name is Kareem Kanji. Thank you so much for joining us. We are doing our fourth and final episode of these conversations focused on health and technology, and we look forward to hosting you at Health Connect. Make sure you've registered at healthconnect.eventbrite.com. Very excited today to bring to you a conversation with the CEO of Palomino System Innovations Inc. We have here Markus Latzel. He has initiated and managed multiple collaborative research and development projects with various industry and university partners. His day-to-day work is to drive and execute Palomino's strategy and oversee the technical vision for the WebPal product suite. Markus, thank you so much.
Thanks, Greg,
for dropping by. Really appreciate it.
Pleasure.
Well, let's first answer this question. What is the WebPal product suite?
The WebPal product suite is a cloud server application that is primarily focused at document management, workflow integration, and content management. So pretty much workflow applications that are very content rich and require a lot of collaboration. So one could see it initially as a content management system.
Sure.
But we have a very strong foothold in healthcare, among that financial services as well. But in the healthcare sector, we're addressing mostly the needs for patient record systems, electronic health records, communication between different caregivers and different disciplines. So a number of different things that we're after.
You know, when people talk about content management systems, you know, they're thinking about, you know, your basic website where you want to upload content, whether it be written, photo, video, or whatnot. And you guys, you know, you just finished talking about how, you know, you do some work in the healthcare and financial services industry, and this sounds like a lot more. You're doing a lot more things here. Can you explain to me a little bit about how WebPal, how this product, WebPal, works with healthcare and why it's so powerful?
Okay. Maybe the best is an example.
Sure.
We have a client out in Nova Scotia, of all provinces.
Okay.
There is a region of 5 different hospitals with different healthcare practices. So we're talking mostly long-term care. So we're talking senior care, community care, palliative care as well, that currently have trouble working collaboratively in a way to actually exchange information about the patients. So their mandate of providing patient-centric care is currently suffering because they mostly have the problem of actually sharing information. So if you turn that around to a technology environment, you're actually we realize this is a content management issue. There's a lot of content being generated by the caregivers about the patients, yet that content is not being shared and is not being shared adequately.
To other caregivers.
Exactly, with the right providers.
Yeah.
So, you know, picture a community care nurse that is visiting the patient. Currently they have the community care paper-based records with them. They realize, you know, last time this patient was visited by community care, there's certain issues that were identified, emotional issues, pain issues, pain relief, even family issues. You know, there's knowledge about who the caregivers in the family are, the informal caregivers. All of that information is passed on by caregivers within a paper-based record, but unfortunately that stays mostly within the same discipline, within community care. So now, that patient is being transferred to another program. In some cases, of course, unfortunately, palliative care. But in other cases, it just gets transferred to a different jurisdiction, or it gets transferred through a referral to physiotherapy or occupational therapy, for example. There is information that is very valuable if that gets transferred to the other disciplines. And again, we have the problem, we've identified the problem that in healthcare there is a lot of different disciplines, there's a lot of different work groups, they all have different systems that they work with. Usually these systems are very have very high constraints on the kind of data that can be put into them, if there are systems at all. They're very much relational database driven. So they're difficult for caregivers to handle and difficult to use. it is much easier for them to treat this type of content the same way that they would treat their paper-based records. Here's a form that needs to be filled out.
Yeah.
I have a visual of that form.
Sure.
It, you know, if I have it in an electronic way, it actually should look like a paper form. I should have the feeling that I can print it out, that I can pass it on to other caregivers, or even leave a copy in the home with the patient. I should have that physical connectedness to content that is being supplied by the caregivers and that is also passed on to me as a caregiver.
There shouldn't be such a huge learning curve on, oh my goodness, how do I use this tool now?
Absolutely.
And it should be very intuitive to use, because, you know, caregivers are focused on one task and they want to use this tool to ensure that other caregivers, you know, for this patient are able to access that same information. I'm very curious, Markus, if, you know, something, you know, here in Ontario, there's been a lot of talk and discussion, especially recently with what's happened with the leadership about e-health. And was something like this, what, you know, was what you guys are trying to solve with WebPal, was e-health trying to solve that same problem as well?
Well, e-health and e-health infoway, I mean, they're trying to provide the basis for exactly this.
Okay.
Absolutely. I mean, the goal of the e-health infoway is to interchange information, to provide a common system and a common structure on which we can exchange information.
Yeah.
As we know, the adoption is very slow.
Mm-hmm.
There is still a lot of systems out there that still need to be connected. It is not easy to get all these systems connected, and eHealth Infoway does not necessarily provide very straightforward guidelines and policies, or in fact sample cases of how that integration should happen. So still, most healthcare providers are, I'm not going to say out on their own, but
Sure.
they still have to find their own solutions to solving their problem. What we're trying to address is we're really looking at the other end. Speaking about IT adoption, if you guess what the adoption rate is in healthcare for a new IT component within their process, it's 3 years.
Wow.
It's 3 years is the average adoption time for IT in healthcare for a new IT system. That is immense. I mean, what we're trying to do
Is there a reason behind that, by the way? Like, why is it so long?
Caregivers, and you just said it, caregivers are very focused on the actual work that they are supposed to do. They're focused on their patient. They really love helping their patients, and they have 99% of their day filled with the need to help the patients.
Yeah.
Unfortunately, a lot of the caregivers get distracted. We found that in a typical community care or senior care scenario, about 40% of the nurse's time actually gets spent on documentation, paperwork, office work, as opposed to...
That is a lot of time.
That is a big number, absolutely. So, of course, you know, we're hoping that information technology solves this. We're hoping that we can reduce the 40% to 20% or 15%.
Sure.
But in order to get there, we have to first adopt the IT, and then the IT has to deliver.
Yeah.
And that is the tricky part. If we force nurses and caregivers to start using databases to record every single thing that they do with the patient, we're forgetting that healthcare is in the end still a people business.
That's right.
We want to enable caregivers and patients to communicate with each other, and caregivers to communicate within a team and a healthcare team around the patient without actually asking them to do more work and double entry information into a database, which ultimately no one is going to look at anyways. So the interesting thing though is that there is good news on the horizon, and that came with the advent of mobile technology and tablets, and technically in general computing power that is now brought closer to the caregiver while they're interacting with the patient. So rather than asking the patient to come into their office, sit down, a lot of patients can't even do that. They're not that mobile.
Sure.
Right? It's impossible to say, sure, come into my office so I can sit behind my desk, tap things into my computer as I'm asking questions, and within 15 minutes, you know, develop a care plan for you. That's almost impossible and downright rude. to the patient to say, I'm going to sit behind a desktop that has this big huge screen and I'm going to hide myself.
Yeah, it dehumanizes the whole process.
Exactly.
But you're right, when you're talking about, you know, everyone having a tablet and everyone having a smartphone, that almost brings people closer together now.
So what is now happening is that as a caregiver, I can be in the patient's home. I have full connectivity. I have the laptop, the iPad, the tablet, the BlackBerry, whichever it is, the Android, I have it right in front of me. And as I'm talking to the patient, just like I'm talking to you right now, I put a few notes in there.
You're inputting, yeah.
Usability, of course, is very important. So what's going to happen is, instead of having to write things out in plain English, I get knobs, sliders, checkboxes,
absolutely,
drop downs that make it very easy for me to quickly select what my assessment is. What's your pain level? From 1 to 5, what's your current pain level?
That's right.
Can we do a Berg assessment, which is an assessment method for balancing? So it assesses how well your balancing skills still is, right? So you have a few different tests, a few different questions that you ask the patient, or you ask the patient to do certain things. Or even better, you take this whole thing, you flip it around, you show it to the patient and say, here's an image of a human body, why don't you show me where it hurts?
Where it hurts, and it records all that information.
Exactly, and then basically you have the information right in the system and you can actually take notes on it.
They must have voice technology as well, where you speak to it and it types everything out for you as well.
Voice technology in healthcare has been around for a while.
Yeah.
One big product that most doctors know is Dragon Speech.
Okay.
There is, of course, an issue with voice recognition in the sense that if you're going out there to meet the patient in their homes, you don't have that controlled environment. You may have the dishwasher running in the background.
Kids running around.
You may have kids running around. You may have all kinds of different environments that don't really let you do dictation. The other thing is that not necessarily everything that you want to put down into the device should be immediately shared with the patient. You know?
Okay.
It's not like I can, as a doctor, as a physician, or as a caregiver, I can sit there and talk to you, and you know, you tell me your story, you tell me things about your family. So you say you're an elderly person, you tell me things about your family, right? And in between the lines, I'm reading all kinds of things.
Yeah.
Reading does not get sufficient support from the grandchildren, for example, right? So I would write that down.
Yeah.
But is that something that I would want to dictate into the device?
No, probably not.
While you're listening? No, absolutely not, right? So these are the kind of things that mobile technology now makes possible. And it's amazing. I mean, we started the development on this project before the iPad came out in Canada. I went across the border and got one in Buffalo just to get the developers started on it. It was really interesting to start evaluating what we can do with HTML5, with web application technology, jQuery, and local storage, and all these things as well. It was quite a great experience, and as a result, now we have this application out there which is based on the WebPal cloud server. It's based on document management. It pushes information back and forth between different health practices. And it works on Android and iPads and so on. And that's really the sort of feedback that we get from that is quite fantastic, actually.
How important is design?
It's an interesting question.
You know, because you talk about 3 years for adoption, but I would think that nurse and other medical practitioners would go, I can take all this pads of paper that I carry around with me and break my back with, and just carry around a tablet. Oh, how heaven! I'm in heaven. Is it a problem that they don't want to change, or is it when they change, they have this device and they have this program, and it's like, I'm reading Greek, I need to learn a brand new language? So does design play a role in helping to shorten the rate of adoption?
Yes, absolutely. I would say healthcare is still one of the practices where, in general, functionality trumps design. Speed of the application is very important. If you need to record a pain assessment scale and that field for pain assessment is just not there, it doesn't matter how well the application is designed. It just has to be there. You have to be able to record it, otherwise you're going to go back to paper right away. But once that's taken care of, design is very important, and you're absolutely right, it can reduce the barrier of entry dramatically. So, for example, if you take an application and you say, look, you know, we have your 153 forms, different form templates that you're using within this health authority. We have sent out our requirements analysts, we've walked through every single one of them, we scanned them all in. We know exactly which form is for what, when you're using which form, what type of assessments you're doing.
Yeah.
These are the paper forms that you're used to. If we take those exact forms, exactly the way they are, and put them on a tablet device, so that immediately you can browse through them as if it was a paper-based.
And they recognize it also.
They recognize exactly the forms. Oh yeah, this is my 4-page intake. Click on that. Yeah, and here's the fields, and they're laid out exactly the same way that were on the paper-based forms. We found you can dramatically reduce the adoption rate for that. So, you know, typically within a couple of days you can have a caregiver up and running, right? The real kicker comes when they open up these forms and half the information is already there. That, of course, is...
That is amazing.
That's a kicker for them, right?
Yes.
They're like,
I don't need to write the person's name again 50 times.
Exactly. You're asking me about my medication again? Why? Right?
Yeah.
So, you know, it's these kind of issues that you can now solve, as long as, from a design perspective, and that's why you're right, it is very important. As long as from a design perspective, you make this appealing and you reduce that barrier of entry. Yeah.
You recently had the opportunity with you and your business, Palomino, to go to IT Health Canada 2012, a few weeks back. And not only have a booth there, but you also presented a couple of times. Very interested in that. I know one you talked about, one of the topics was towards an adaptive knowledge-driven care flow management system. And the other one you were really taking a look at mobile devices and automatic home heart monitoring. So I was wondering if you could touch on these two presentations and these two projects that you worked with. Who did you work with, and what sort of information and insights were you able to derive from these?
Sure. Now this project that I spoke about as an example of 5 hospitals out east.
Yes.
We're working together with St. FX University there. They have a Center for Logic and Informatics that is working with us on workflow verification.
Okay.
So Dr. McCall there is very interested in finding out how do we analyze caregivers' workflow. Once they start using a system like this, once they're entering information, can we analyze in a methodical and logical way whether the general healthcare norms and practices are being followed? So it's not about a performance analysis or a performance evaluation of the caregivers. It's really about performance evaluation of the entire system that they're interested in. So there's research happening. So essentially what we're doing is there's some algorithms that are designed by the CLI, which are part of the system, which help analyze how well is the patient being taken care of, and do we really follow a patient-centric approach? And this is what one of the presentations at IT Healthcare was about, and we were getting some feedback on, where Wendy, Dr. McCall, and I were presenting the solutions and our findings on this, and getting some feedback on the approach that we were taking. So we had some great feedback. It was great. It was a great audience there. The other presentation was where we took the whole system to Ottawa and used Algonquin College's simulation facility.
All right.
So I'm not sure if you have been at Algonquin College, but they have a research facility where essentially they have an entire hospital ward and a senior care environment set up to simulate healthcare scenarios, to train nursing staff and perform simulations. So essentially what we said is, hey, we have this technology here. We're bound by privacy constraints to not be able to, we can't send our developers into the patient's home and look over the caregiver's shoulders and then see how well the system is doing. We can't really do that.
Okay.
So the next best thing that we can do is we can simulate the environment, we can simulate a patient, we can bring real nurses in to interact with these patient actors.
Yeah.
So we had, if you believe it, we had professional patients.
Professional patients.
Professional patients. So they were awesome. I mean, they really knew what they were doing, and they were actually retained by Rockwell College on numerous occasions before to train new nursing students.
Sure.
Right. So these professional patients were acting as elderly patients that had certain issues and were being visited at home or in the hospital, and we had nurses with the iPads and the tablet devices. We tested both iPad and Android. Approach these patients and take assessments and interact with them, both to evaluate how well the nurses are doing, how well they're adapting to the technology, but also to evaluate how the patients felt when such a technology was used. So did they still feel that disconnect, that you would feel when you're sitting in front of the desktop, right?
Is the nurse focused on them, or are they focused on their screen?
Exactly. Right?
Sort of the same thing at the dinner table.
Yeah. Yes.
Are you looking at your phone, or you're paying attention to the family?
Exactly. Of course, some of them were joking. So, are you sending text messages right now, or are you writing down what I tell you, right? But in general, the feedback by the patients, in this case, we could trust their feedback even though they weren't real patients, because they had, of course, everybody has been a patient at some point.
I think so, yeah.
Most people have, unless they're real lucky among us who've never seen a hospital from the inside. But pretty much everybody knows roughly how that scenario is, right? So they could give us good feedback on how it came across when a nurse was holding a tablet to interact with them. And it was generally very good feedback. One item that we were interested in also is there actual time savings? Can we quantify the time savings when mobile devices are being used?
Yeah.
So we tried to quantify that. We actually found that was roughly a break even.
Okay.
The only difference being that now the information was actually immediately available to share with other caregivers. So all of that bureaucratic effort after the patient visit, to share information, to fax it out, to do referrals.
How much time did that save? So information was available immediately. So capturing the data, same amount of time. But sharing that information now was almost instantaneous, or the ability to share was almost instantaneous.
In fact, instantaneous.
And so, what was it like before? How long did it take for that data to be shared to the proper other healthcare providers?
It's a very good question. That we would have loved to simulate that and get a direct comparison as well. That is very difficult to simulate because it really depends on the bureaucratic setup that
we're probably talking at least days, if not hours, or hours, if not days.
You're talking about time delays, right?
Yeah.
You're talking about sometimes caregivers don't even know that the information exists, so they don't know to ask for it, right?
Interesting, yeah.
The only way that they would know that the information exists if, say, the patient gets visited 5 days later, and then the patient sort of mentions, or a family member mentions in passing, oh, by the way, the doctor was here last time, asked for a blood test, right? I'm like, oh, that's good to know. Why don't I see if I can get access to that, right? Whereas, obviously, in a fully documented mobile scenario, you'd have that right there in front of you, right? If the information is properly shared. If it's not shared electronically, then you have to ask for access. You have to basically call somebody and say, can you fax me the results? That takes another couple of hours turnaround time, unless you have a very well-oiled administrative machinery in the background.
And it has nothing else to do except look after that one request.
That's right. And I'm saying these are not, these are still needed, but the point is, why not have access to that information right away as opposed to having to ask for it? Access control is, of course, important, but after that is taken care of, really the time to access should not be that long anymore.
What are the implications, down the road in terms of the the ability for a healthcare giver and the ability for a patient to have their information literally at their fingertips. You know, I can guess what the implications are. What are the implications? Instead of now waiting days or weeks to get information back to you, I can see it where, you know, you're gathering data and all of a sudden your tablet beeps and says, you know, based on the information that you've inputted, this is what needs to happen. You know, whether it is, you know, Kareem needs to go see a doctor for this based on the data we've collected over the past weeks or months or whatever the case may be. Or rather than, you know, you go see a doctor and it's like, we'll call you in a week, you know, if there is anything, if we come across anything, rather than we know right now, because all this information feeds into one place that your healthcare provider has access to, that you've given them the permission to have access to as well. I'm curious what your thoughts are.
It's a very good question. And you know what, I've had some background in being involved in healthcare as a paramedic in an emergency scenario. Of course, access to information, immediate access to information is very critical.
Yeah.
If you're someone involved with ER, any of that type fast-paced environment where the patient condition can change very rapidly from hour to hour, from minute to minute. Of course, access to information and fast information is very critical.
Yeah.
Then you have the long-term care scenarios where the complete opposite end of the spectrum applies. The patient gets visited. It's a checkup visit.
Sure.
Twice a year, right? Of course, the timeliness of the information is not that critical if you think about it. However, if you also think about it, if it's difficult to get that information across, then sometimes information gets lost within the system.
Sure.
You know, half a year later, you don't remember quite anymore. Was a blood test done half a year ago or not? Right? Can we dig up that information or not? Right? It's that kind of information that sometimes when the distances between patient contacts are such a long time that having that information in the central repository is even more important.
Absolutely.
As opposed to in an ER scenario, where basically what you do, I mean, if you've been in an ER, basically what they do is they stick you in a bed, they rush you through the hospital, and there's a patient chart which is basically almost glued to your body, and whatever additional information gets gathered in the process just gets they keep sticking it on,
stapled on there.
So any doctor who wants to see you just grabs that chart and flips through it and says, yeah, that's great, right? I have the information at hand. So you might even argue that electronic data entry in an ER scenario is almost not the best choice, because again, you know, we're humans. We know how to quickly disseminate information if we can flip through paper.
Unless you have to do some sort of a diagnosis. There's a great article written on our website, xconnectto.com, by Dr. Kareem Jessa, who's an emergency doctor up in the York region, and he wrote a phenomenal piece on something that happened to him being in the ER room, and you know, seeing information and saying, well, how do I get this information to another doctor who is a specialist in this area, so I can properly diagnose and properly treat. You know, and then taking that data and figuring out, you know, we need to have technologies and programs that can speak with each other, or at least speak the same language. So when I take this information, you know, shoot it through the system, it comes, you know, it's able to go through the system. The doctor on the other end can take a look at this information and then, you know, communicate back to me, here's what you need to do, or here's what we think is going on.
Absolutely.
You know?
Yeah, so for outside consultations, you want to give that specialist the most complete picture that you can deliver. Right?
Absolutely.
And again, the faster you can get all that information to that consultant is critical.
Yeah.
So.
Like they say, technology is supposed to make our lives easier and better and simpler, right?
Yes.
And hopefully technology, digital, social, all these things can enable us to not just live healthier lives, but enable the people that we trust our health to properly, you know, give us the advice and the diagnosis that we need. And things like Health Connect and all this information that we're gathering and sharing is going to be phenomenal, especially at the panel discussion as well. And I would also like to thank you for being a sponsor, Palomino, for being a sponsor of Health Connect.
Pleasure.
We're out of time. Where can people find out more information about what you guys are doing?
You can certainly find more information right here at XConnect.
Thank you.
And of course, if you want to visit our website, palomino.com, on the generic platform webpal.net for the cloud content server, that's pretty much where you can learn everything about what we're doing. We're publishing a blog where we update everyone on our progress, and if you have any questions, give me a call.
Fantastic. And we'll put his contact information up on our website. We'll see you at the panel. Thank you, all of you, for joining us. Again, my name is Kareem Kanji. You can find me on Twitter at Kareem Kanji. Thank you for joining us, and we look forward to speaking with you again soon. Bye-bye.